Hi, I'm Josh Out.
I'm Lauren Freely.
I'm Brianna Prince.
And I'm Olivia Daniels.
Today we are going to bring awareness of narcolepsy to America by just discussing what narcolepsy is, some symptoms, and what you should do if you think you have it. So to start, what is narcolepsy? Narcolepsy is a chronic sleep disorder. It's characterized as an autoimmune disease because the body attacks itself. It is also characterized by overwhelming daytime drowsiness and sudden sleep attacks. It diminishes the capacity to control sleep-wake cycles, and it affects roughly 1 in every 2,000 people. So it is pretty common. There are two different types. There's type 1, which occurs with cataplexy, which is sudden loss of muscle tone, and there's type 2, which occurs without cataplexy. How does it occur? The cause is unknown, but there is research going on currently trying to understand it. Right now, they believe people are born with certain genes that put them at a higher risk for developing narcolepsy. An infection may trigger the onset of narcolepsy because instead of the immune system attacking the infection, it attacks the cells in the brain that produce hypocretin. It is possibly associated with the swine flu virus and certain forms of the vaccine that administer in Europe because the body initiated an immune response to the vaccine, and instead of attacking that injection site, it attacked the brain that produced hypocretin. It affects men and women equally, so it's not favoring one gender over the other. Genetics could play a role. There is a risk of passing it down to your children, but it is as low as 1%, so it usually does not occur. The risk factors are age and family history. It begins in people between the ages 10 to 30, and the risk of narcolepsy is 20 to 40 times higher if family members have narcolepsy. Again, I'm going to talk about the two different types. So type 1 is the hypocretin producing cells in the hypothalamus have died off. Again, the immune system attacks these cells so they cannot produce it. Loss of hypocretin neurons is thought to lead to inconsistency of wake-promoting neurons responsible for maintaining wakefulness, muscle tone, and inhibit NREM and REM sleep-promoting neurons, which are the dopaminergic, noradrenergic, and serotonergic. Certain wake-promoting hormones that also suppress REM signaling fail to inhibit REM-promoting neurons, resulting in cataplexy, which again is that loss of muscle tone, which happens during REM sleep. Wake-promoting neurons fail to activate cortical and subcortical arousal regions and inhibit sleep-promoting neurons, which are GABAergic, causing excessive daytime sleepiness. Type 2 is likely a heterogeneous disorder. Hypocretin levels are usually normal or unknown, and the cause of this type is completely unknown.
All right, so I'll talk about some of the symptoms associated with narcolepsy. It's the uncontrollable urge to sleep, often at inappropriate times. This is known as excessive daytime sleepiness. You can have the weakening of muscles, which is what Bree said with the cataplexy. You can have poor quality of sleep at night, and this is associated with disruptive nighttime sleep. You're feeling unable to move or speak when falling asleep or waking up, which is known as sleep paralysis. So your body, while you are awake, your body thinks that it isn't. That's why you're unable to move. You can also have vivid, often dreamlike experiences. These are the hypnagogic and the hypopommic hallucinations. And then you can also have changes in rapid eye movement, such as other symptoms. People with narcolepsy are more likely to have certain conditions than with those without narcolepsy. This includes depression, anxiety disorders, other psychiatric disorders such as bipolar and agoraphobia, have high cholesterol and high blood pressure, diabetes, cardiovascular disease, and restless leg syndrome. Other characteristics is that people with narcolepsy may have other sleep disorders such as sleep apnea, which is when the breathing starts and stops throughout the night. You also have, like I said, restless leg syndrome and insomnia. And some people with narcolepsy also experience autonomic behavior during brief episodes of narcolepsy, so they continue to perform a task normally as they would right before falling asleep, and they still carry it out when they are falling asleep. So just going off of what Bree said, the types of narcolepsy. Type 1 is based on the individual having low levels of the brain hormone hypocretin or reporting cataplexy and having excessive daytime sleepiness on a special nap test. Type 2 narcolepsy, people with this condition experience excessive daytime sleepiness but do not have muscle weakness triggered by emotions. They tend to have less severe symptoms and normal levels of the hormone hypocretin. And individuals may have severe neurological problems with sleeping for long periods, and this condition is known as a second narcolepsy, which can result in injury to the hypothalamus.
Then we'll go into the prognosis of narcolepsy. So a clinical examination and detailed medical history are essential for a diagnosis of this immune disorder. Individuals may be asked to keep a sleep journal, noting the times of sleep and symptoms over a 1 to 2 week period, just to know how long they're sleeping, when they're going to sleep, when they're waking up. 2 specialized tests are performed in a sleep disorders clinic. The polysonogram, the PSG, or sleep study. This is an overnight recording of brain and muscle activity, breathing, and eye movements while a person's asleep. This can determine whether REM sleep occurs early in the sleep cycle and if symptoms result from the condition sleep apnea. Then there's also the multiple sleep latency test, the MSLT, which assesses daytime sleepiness by measuring how quickly a person falls asleep and whether or not they enter REM sleep. After the PSG test, individuals are asked to take 5 short naps separated by 2 hours each. If an individual falls asleep in less than 8 minutes, it's indicative of daytime sleepiness. Individuals with narcolepsy also have REM sleep start abnormally quickly. If it begins within 15 minutes or at least 2 times out of the 5 naps and the sleep study the night before, it is likely caused by narcolepsy. Occasionally, it may be likely to measure the level of hypocretin in the fluid surrounding the brain. This can be done using a spinal tap procedure. If you have low hypocretin, it usually indicates type 1 narcolepsy. And then treatment for narcolepsy, there's no cure, but medications can help a patient manage the symptoms of the disease. So medications that are commonly prescribed are stimulants, which help people stay awake during the day, so hopefully they can get a better night's sleep. SSRIs, which are usually used for anxiety and depression. They can suppress REM sleep to help alleviate the symptoms of cataplexy, hypnagogic hallucinations, and sleep paralysis. Tricyclic antidepressants are also used. These antidepressants are helpful with cataplexy, but there's often a lot of side effects to these, like dry mouth and lightheadedness, so lots of people don't like taking these. And then there's also sodium oxybate, or Xyrem. It's highly effective for cataplexy and helps improve nighttime sleep. And then in addition to medications, there's also a lot of lifestyle and home remedies that are beneficial to helping with the side effects of narcolepsy. So sticking to a schedule is really helpful, going to sleep and waking up at the same time every day, taking naps throughout the day. It's noted that naps of 20 minutes are beneficial for reducing sleepiness for a few hours after the nap. Avoiding nicotine and alcohol is also helpful because these substances can worsen signs and symptoms of narcolepsy, and getting regular exercise can help you feel more awake during the day and sleep better at night.
All right, so I'm going to talk about research and how it's an autoimmune disease. So a study reported by a group of sleep researchers in Japan had discovered antibodies in the brain that appear to attack tribbles, which are small granules that contain brain cells that produce orexin, a brain chemical that helps maintain the delicate balance between sleep and wakefulness. So patients with narcolepsy have less orexin in the brain. That's also known as hypocretin. So in order to kill other cells, CD4 and CD8 T cells and neurons producing orexin usually have to work together. But in 2018, scientists discovered autoreactive CD4 T cells in narcolepsy patients. These cells then recognize and target neurons that produce orexin. So this is a story about someone who is living with narcolepsy. So narcolepsy is a draining disorder that interferes with all aspects of a patient's life, including school, work, and relationships. So we saw an interview on Emily, who is a 28-year-old bookkeeper and competitive snowmobiler who lives with narcolepsy. So in an interview on knowNarcolepsy.com, she discusses her story and how she manages to live a full life with her condition. She says that she lives a normal life just like anyone else. It's just more difficult due to symptoms that make her feel tired. She opens up saying that she sometimes feels worthless because of the labels that other people can put on those with narcolepsy, such as lazy and unmotivated. She speaks on how the condition makes her feel exhausted a lot of the time and that she does not have as much energy as people without it. This requires Emily to be creative and to find ways to use her energy efficiently so that she can accomplish all that she wants to. She's learned to allocate her energy to put it towards what she finds most important in life. Her symptoms have become a part of her life, and she does what she can to manage them, but understands that it has become a major component of it. So Emily has come up with strategies for living with narcolepsy, such as giving herself extra time and flexibility in her schedule. She makes sure not to have too much going on at once. As she puts it, piling too much extra on her plate. She doesn't allow narcolepsy to rule her life because she is the same as everyone else, even if it takes her a little bit longer to get there. It's the little changes she makes to accommodate her symptoms and acceptance of her situation that allows her to live a fulfilling life.
Well, thanks, ladies, for having this discussion about narcolepsy. I hope we can help some people out.
Yes, I feel a lot more educated after it. Bring awareness.
Me as well.
I hope our viewers learned a little bit too.